got from Just Jenny. Listen to SiriusXM Stars. It's where I go to get advice. It's inspiring. It's about helping one another. SiriusXM Stars. It's my life on radio.
You're listening to Dirty, Sexy, Funny with Jenny McCarthy.
Pick up your phone. I'm on the request line.
Oh my God, I love Missy Elliott. I love her so much. I rolled my balls off to this fucking song. I had it on replay for 10 hours by myself, like, oh my God, this is so good. Welcome back to Dirty, Sexy, Funny. I'm Jenny McCarthy. Listen, we cover it all on this show. And this is the kind of shit that I'm so happy I have a radio show because I want to talk about it. Dr. Powell, Dr. Robert Powell.
Charles.
Dr. Charles Robert Powell. Robert Charles. Which one is it?
Charles.
Is this Charles?
Yeah.
I want to Charlie. And if people wanted to find you, though, Charlie, what are you under officially?
It's Dr. Charles Powell.
Well, let me just cross off the word Robert that's on my thing here. Charles, thank you for coming in. Listen, ladies, listen to me right now. Stay in the car, get your girlfriends over to the radio, and men, if you have a wife, listen up. He just found a new surgical procedure for labia and vaginal tightening. It's called ThermiVa.
That's it, exactly.
God. Excessive stretching of the vaginal muscles is a common occurrence after birth, also probably age. Let me start with this. I've got some before and after photos, and I've seen, and they're, by the way, guys, it's incredible the difference between before and after. Now, I've known people to go in to get the surgery, both, and they've had their beef curtains trimmed, and they had to actually slice them off, though.
Right.
And you're saying there's no knives involved.
Well, this procedure with ThermiVa, that's what interested us. It was almost too good to be true when we first learned about it. We've been familiar with the company for a while. I got a chance to see the procedure performed with one of the pioneers in the whole protocol, and to see the changes before your eyes, it was just amazing. I was on board immediately.
Okay, what kind of doctor are you, just so I know?
I do cosmetics, and I do general medicine. I do a little bit of it all.
Okay. I just want to make sure you weren't a dentist.
No, I'm not a dentist. I'm not a chiropractor or a podiatrist or a dentist. We're good.
It's kind of weird when my dentist is like, do you need a pap smear? Okay, so what does something like this cost?
You know, this is broken down into 3 treatments. They're typically 30 to 45-minute treatments, about 1 month apart. Whole package typically runs about $3,000. It's much more affordable than the surgical alternative.
And considering that women are so sensitive and insecure about their lady bits, this could be the difference between having a great sexual relationship for the rest of their lives and not.
That's what it comes down to. I mean, besides a more invasive procedure, there hasn't been a whole lot for women to really look at in relation to this. And the surgery has a long downtime, has certainly the complications that can come from surgery itself. This is simple. It's not painful. There's no anesthesia involved. They play on their phones or they watch TV while the procedure is performed.
And there's no downtime?
No downtime. They can have sex the very same night.
And now, I don't want to confuse the two surgeries, not surgeries, two things here. Okay. There's the labia surgery, God damn it, what do I call it, procedure?
Procedure, yeah.
Okay. There's the labia procedure and the inside of the vagina tightening?
Exactly. So it's all done at one time. You know, whereas labiaplasty and vaginoplasty, the surgical options, are sometimes done at the same time, sometimes separately. But this is all one 35, 40-minute procedure performed at one time.
What if one woman only has, like, the big blown-out vagina inside and they don't want their lady bits tightened? Can you do one or the other?
You can, but there's other benefits to this as well. When the company Thermi first started looking at this procedure, they were looking for something for external and internal tightening only, but they saw so many other benefits come from this.
Like?
They saw women that had vaginal dryness that were in their perimenopausal years regenerate and start having better situations there. They saw women with urinary incontinence, with stress incontinence, where they cough or they sneeze and a little bit leaks out. They saw improvements there. And they even saw women, best way to say it is regenerate nerve tissue. Women that had not had orgasms in years were suddenly able to again. The whole radio frequency theory there is that it's actually regenerating nerve tissue.
That's crazy.
Absolutely.
And how long has this been on the market?
This has been out on the market less than a year.
Less than a year. So then who do they test it on?
There was a very long line of willing participants in that test.
Really?
Absolutely.
Okay, so then can women have sex immediately?
Immediately afterwards,
That's
absolutely.
crazy.
Well,
My girlfriend had to wait like 2 months.
That's right. You know, what's nice about this, a lot of our clients will actually come in and not even tell their husbands. And, you know, I
They
remember
probably don't even notice a difference, the guys, because they're just like munching on whatever.
Just the opposite.
Really?
Oh, my gosh. So, you know, what I say is this isn't just for women. This is for relationships.
Totally.
You know, I think the third patient I ever did is I was talking to a beautiful, beautiful woman who we were just chatting back and forth, and it was really embarrassing because she was taking pictures of me with her camera phone. But, you know, she was being fun. Anyway, you know, as we're talking, making small talk, I know her husband, and I said, so what do you think? Are you going to tell him? She's like, oh, no, I'm not going to say a thing. Trust me, that's only once a month anyway. I'm like, really?
Wow.
It surprised me. And she goes, yeah, you know, it is what it is. Well, I got a call that Sunday. The once a month turned into 6 times that day.
No way.
Absolutely.
This is crazy. I feel, is this real, everybody? Is he not? Is this like April Fool's Day? I think you're going to help so many women. You have no idea how many women I talk to with this issue.
Well, a lot of women don't even feel comfortable talking about it. But you know what's crazy, Jenny? When every procedure we've done, we show them the before and afters on the way out, because even after the first treatment, you can see immediate effects from it. They're walking out, they're taking pictures with their camera phone and texting their friends their
Their
before
vagina.
and after pictures.
Or their,
yeah.
I shouldn't say vagina, but you know what I mean.
Yeah, exactly.
The lady bits.
The lady bits. And they have no shame on it. They're like, it looks great now. I want to show people.
Does it get weird, and be really honest with me, to see vaginas all the time when you do this?
It really doesn't. You know, after a while, it's just... It's part of what we do. It's a job, and we keep it real and keep it professional.
And, I mean, what do women consider collectively an ugly labia? What would they consider embarrassing?
You know, typically what they'll see is, especially the labia start to sag, or maybe the introitus of the opening is not completely closed anymore. Those are the things that they'll see that may not look so attractive, and also not feel so attractive in some tight-fitting clothes.
Really? Oh, because it sags.
Exactly.
I did not know that. I mean, really? So how saggy do they get, like labia?
They can get pretty impressive. And I'll tell you, you know, this procedure is great for mild to moderate laxity. Anything that is severe does still need to go under, you know, labiaplasty, the surgical option.
So if we don't really, how do, you know, because when we're laying down, spreading our legs for our man, and the labia, we might not even know the labia sags. So should we take a picture of it and take a look at it? I mean, it's still horrifying when I do that with my husband, but I guess you don't know if it sags.
A lot of women do. It's amazing how many women have told me they actually will look at that in the mirror. I don't know why it interests some of them, but it does. But, you know, it's not so much the external part of this. There is great benefit there, no doubt. If you can go to our website and look at our before and afters, it is phenomenal. But it's the internal that really impresses the relationship.
Well, I would imagine. There's no hot dog down a hallway. We're talking to Dr. Charles Powell. He's got a new procedure called ThermiVa.
ThermiVa.
Thank you.
You got
ThermiVa.com. I'm like, you're going to be very, very busy.
That's the main website, but that's for the procedure. If you go to our website,
Which is?
smartnewyou.com.
So it's Smart New UYOU.
You got it.
SmartNewYou.com. And then where do you do these treatments? In New York? Are you local?
I'm in Dallas-Fort Worth.
Oh, so you're in Dallas.
Right. We have people fly in for all over the country for this.
You are going to have people flying all over the country.
Which is wonderful. We're across the street from the Four Seasons. We have a nice setup for women. They get treated very, very well.
So it's three, you have to go 3 times, three 30-minute sessions, but you have to do them 1 month apart.
1 month apart is best. Some women will even take that third procedure and push it out a little bit. But, you know, everybody says, what about after that? Every once in a while, women may need a touch-up once a year, maybe longer, maybe less, just to refresh things a little bit. And I get the question, well, why? Well, the main reason is collagen will continue to break down, and over a period of time, they might want a little freshen up.
I get that. Are there any bad side effects at all?
We have not seen any. At all. I mean, there is heat. Heat is applied. It's done in a very safe environment. Temperature is monitored in multiple different ways to keep the tissue from getting too hot. Women have complained of it being a little bit warm at times, but we adjust the procedure. We make the woman very comfortable through this.
And is it FDA approved?
It is.
I can't even fucking still believe this is a real thing.
That's why I'm here.
And so, not to get too personal, but have you done it on your wife or people around you?
Yeah, she won't mind me saying it.
I mean, I wouldn't mind either. I mean, I keep saying my girlfriend, I'm like, I'm going to be signing up myself. I want to be tighter than... Although I can say mine's pretty tight, but maybe some other things are loose. Am I talking too much right now?
Not at all.
So if women...
You and Donnie could just come down to visit anytime, hang out at the Four Seasons.
I'm sadly too honest. Okay, so do radio waves help women get control and stop leakage? That's what you said.
Right.
In case you do leak. And it helps with dryness? I find that weird.
It does. So heat is basically causing regeneration of the tissue, whether it be nerve tissue and women are getting a heightened sensation, or tissue that's causing lubrication of the mucosa that's in that area. Yeah, it's causing overall regeneration.
Because we've had gynecologists come in here and say that, women, as we get older, that those walls thin out. Like any muscle, they get very thin. And that even sometimes your vagina in old age can fall out.
Prolapse can fall out. Yeah, that can certainly happen. This
Does
doesn't
this prevent
fix
it?
that. This doesn't fix that.
But would it prevent it?
No, this is more of a vaginal treatment and external treatment, whereas that's more of a suspensory ligament issue where holding the female parts up where they need to be.
So, I guess when people call the office, it's not, I guess they're calling for that specific thing, right? Because I know a lot of people are just embarrassed to say the words.
We get a lot of emails on this one because
I would imagine.
it is difficult for them to bring it up at times. And it's a difficult conversation to start with a woman. We have a lot of female clients for all of our other cosmetic services, and starting that conversation is difficult, but it's amazing how many of them want to have that conversation.
It's so awkward, though. Like, I always feel so bad for my gynecologist every time I'm there. I'm like, I'm so sorry that you have to put a light on it and get down there. But you swear it doesn't faze you at all? You don't ever go like, wow, this is Hope Solo.
I have never had that happen, no.
Have you seen Hope Solo's pussy?
No, I have not.
Can I please show it to you?
Sure.
Thank you.
Okay.
Because if you tell me that you would be able to fix Hope Solo's pussy, I'm going to consider you the king of this year of a miracle worker. Because this girl, has... Okay, so I'm looking at this before and afters. So this what do you call this meat? The labia right there?
That's the labia.
Okay. So this is what you mean by the gravity has... It looks like...
Exactly. Probably in that case, gravity and childbirth. That one we can make big improvements on. No pun intended.
And then the inner lips are called the
labia minora. So labia majora are the outside, and the labia minora are the inside.
And so those inner ones you shrink up also.
Absolutely. That's one of the focuses of the treatment.
I can't even believe it. Do you see Hope Solo's pussy?
I'm seeing that. Yes.
Okay.
We can improve that.
Please tell me. I'm going to go over to your computer and look.
We can improve this.
Okay. So, do you see how messed up that is?
That's kind of messed up.
Is
yes.
it one of the worst vaginas you've ever seen?
It's not one of the worst, believe it or not.
Really?
No.
Do you see the cave of a hole she has?
I do, and that can be improved. Absolutely.
Now, improved, give me a percentage of Hope Solo's pussy, because based off this photo, would you say you could fix it by 80% with this shit?
With this picture, only picture I've looked at ever of this, I promise, I would say at least 70 to 80% improvement.
Wow! And then what about all this junk up there?
That's going to shrink down as well. You got to realize all that junk came from collagen breakdown, laxity, probably abuse over the years, who knows. But the collagen breaks down, the heat, the ThermiVa gets in there and causes almost a shrink wrap effect. And then, over time, the fibroblasts produce more collagen, and it just keeps on shrinking.
Why does labia get stretched out? Is it from men sucking on it?
It can be from a lot of different things. Any kind of physical trauma. Childbirth, sex, lots of things.
Genetics,
absolutely. I mean, how many women do you know that are the same age that could look 15, 20 years apart? The amount of collagen breakdown is different with different women, no doubt.
So there's collagen in your labia?
There's collagen in every skin surface and in many, many areas of your body.
So if you're tightening up labia... can you use the same treatment on a face to tighten up?
That's actually where this company started off. Thermi was a company using radio frequency for skin tightening, and their product was really good. I liked it, but they have knocked it out of the park with this product.
Can it work for the butt?
I have been asked that question numerous times. Several people from our community in DFW, and I can say I've never explored that.
Huh. I can't imagine sphincters would be... big. Well, I guess they would be, but
They certainly can be.
I guess they could. I don't. I wouldn't know, but I'm judging from some porns I've seen. You could park a car in some people's. So you said, tell people again the price range.
It depends. We offer a lot of different packages. Typically, you're looking at about $1,000 a treatment, 3 treatments typically. However, we offer a lot of combination packages. A lot of women while there might want to get laser hair removal or various other things done. They're there. You're in the area. Why not?
Because some women, I know, one of my comedians had, I'm not going to, why do I talk so much? Had their labia injected with filler.
Yes.
And it plumped it up.
It plumps it up, absolutely. And this, it's not so much of a volume issue as much as it is the collagen breaks down issue. And this would have worked just as good, I'm sure.
This is amazing.
Yep, it is. Now, I will tell you also with the injectables, though, a lot of women are doing it right underneath the clitoris because it actually makes it push out a little bit for heightened enjoyment.
You mean the filler?
Mm-hmm. Absolutely. But this actually
Mine's
takes,
like a foot.
this takes the need for that away because you're actually contracting down the labia and you're actually regenerating the nerves that are in that area. That's why there's heightened pleasure after this.
Oh, shit. I'm fucked. Michelle, would you do something like this?
I don't need to, but yeah.
You had kids, though. You had kids. Be honest.
They were C-sections.
What?
They were C-sections.
Oh, that's right.
So
your vagina didn't really blow out.
I don't ever pee. I don't have that thing.
But your vagina walls, you don't know if they've thinned out over the years.
That I would never be able to know.
So Stan said, you know what? It is kind of loosey-goosey. Would you go?
If Stan, yeah. I mean, yeah. Listen to this guy. I'm fucking, if I had the problem, I would be in Dallas tomorrow.
Ladies, let me ask you this. If you're the man, how do you start that conversation and not get in trouble?
That's more of a dating question.
I told guys how to do this. On this show, you go, hey, I was listening to Jenny's show, her radio show.
Do you know Jenny?
I say, blame it on me.
Yeah.
And she was going on and on about some vaginal tightening thing, and she was fucking hilarious. And or she was gross. Like, just bring it up that they heard it. Like, I don't even know what that is. What is she was talking about shrinking a labia?
Well, so many men feel self-conscious about talking to their wife about it. I mean, the vice president of ThermiVa was actually at a conference and was approached by someone saying, why are you mutilating women's private parts? And she was just like, what are you talking about? We're regenerating. We're improving relationships. This isn't for men. This is for women.
It's true. You do it for yourself.
You do it for yourself. But still, as a guy, it can be viewed a little negative going up to your significant other and bringing that up. But it doesn't need to be. This is something they probably feel sensitive about as well.
If you offer other treatments, this is a very sneaky thing because this is how backdoor I am in my mind. If it's important to you, men listening, he does other procedures at his office.
Absolutely.
So you can essentially buy a gift certificate as a Christmas present for something else, just general, and they can decide by looking online what they want.
Right.
And then it could just happen to be there. I think that is a really good thing.
It doesn't hurt we're the nation's leaders in this procedure. They'll figure that out pretty quick.
Right. But if you're like, oh my God, do they do hair removal? I mean, do you do Botox and shit?
Absolutely.
See? So you could totally get away with this, guys. Get a gift certificate from his office, and then boom, she's going to wind up doing it. Especially if you have these before and after vagina pictures everywhere. I'm in.
They're there.
I'm coming. That sounds weird, talking about vaginas and saying that. Dr. Charles Powell, I hope I didn't scare you with my frankness.
Not at all. Love it.
Okay, good. ThermiVa?
ThermiVa.
God damn it. I need to go back to dyslexia school. ThermiVa.com, but go to his website, smartnewyou.com.
Absolutely.
And you have do you have a Twitter handle?
I do. It's called @FemSmart, FEMSMART. That was the original name of the clinic, but we started doing men and women's services, so we changed it to Smart New You.
What do you do it with men?
Hair transplants. Body contouring.
I like bald. All right. We'll be right back. This was so enlightening. I cannot wait to have you on again after you do my vagina.
Very good. Game on.